Welcome back, everybody. Welcome back to the Pike County Health Department's bi-weekly podcast. I'm joined once again by the lovely and talented runner of all runners, Tammy Riley, who just cannot slow down. She's got a new thing going on every time I see her. She drives me crazy. But if it wasn't for her doing what she's doing, running around, our county would be less healthy. So I'm joined by her once again. I'm also joined today by Miss Julie Chaney. Now, she's from Cheney's, from other parts of the county. I don't know where she's from, but she's got some great things. We got some really important stuff to talk about. Ladies, welcome.
Thank you. Thank you, Jeff.
Julie, so tell me, what do you do at the Pike County Health Department?
So at the Pike County Health Department, I am a community health educator and the tobacco coordinator. I'm also the tobacco treatment specialist for the health department. I've served in this role about 10 years.
10 years. Okay. So what is the role of the tobacco coordinator prevention? What do you do all day? What is your main focus?
As a tobacco coordinator, I focus on bringing resources into the county, make sure that our people have services available to them and where to find these services to help reduce initiation and help to reduce adult smoking rates throughout the county.
So I talk to a lot of the doctors, and I'm sure, Tammy, you talk to a lot of the doctors and the physicians who come and see you. Pike County smoking rates are through the roof, or they were through the roof.
Yeah.
We're seeing a decline.
Yeah.
First of all, talk about the decline in the smoking rates, and we'll talk about why people get started, and then we'll talk about how people can get off of that. So what do you think the decline is all about?
I think the decline is making sure that people in our community know what resources are here and advocating for those resources, making sure that they are visible and equitable to everybody. We have to make sure that everybody knows, not just with the health department, but where to get these other services at throughout our county. We take a lot of our services mobile because we know transportation is an issue in our county. I go out to senior centers, veteran centers, and other entities in the county to make sure that people have access closer to their zip code for these services.
And Julie's also has school-based programs that are embedded in the school. But let me interject something here. Yes, our rates are going down. That's a really good thing. And when I say our, I mean Pike County rates are going down compared to where they were 10, 12 years ago. They were up in the mid-30s in the early 2000s, and now we have them down to around 23% according to county health rankings. However, these rates are self-reported, adults only, and so it's just voluntarily, stating on an insurance form or somewhere that's reportable or gets into our stats that you're a smoker. So it's self-reported data, adults only, and it does not reflect the most current issue, which is youth vaping.
Sure.
Right.
So I just wanted to point that out.
Yeah, that's so
Absolutely.
years ago, smoking was cool. If you remember, well, you don't, you're probably too young to, and you're way too young, so I'm not even going to bring it up to you. But when I was growing up,
That's not true.
when I was growing up in the
We had a
70s,
smoking section in my high school.
we got a smoking section in my pool. No, I'm only kidding. When I was growing up in the 70s, Joe Camel was there, and you were allowed to have newspaper ads and TV ads with Joe Camel because Joe Camel was smoking those cigarettes, and everybody was cool about it. And the reason why my generation started smoking is because of that. And then the federal government decided that having that type of animal or mascot, if you will, encouraged youth smoking, which it did. And they banned all smoking cigarette tobacco ads from print and TV and stuff like that.
Correct.
What is making people start smoking cigarettes at an early age, or start smoking tobacco or use of tobacco?
I work a lot with children in the school system with the prevention-based education, and that is the deep-rooted question that I ask them every day. I said, we need to hear your voice. We need to hear why you guys are falling for some of these marketing, falling for some of these tactics.
Yeah, imagine a Jolly Rancher flavored,
Yeah.
Vape.
Vape.
Yeah. But anyways.
And they say one thing that is enticing them to vape is the world of flavors. It looks like candy. The packaging is looked to mimic candy wrappers, and they offer so many flavors. There's basically a flavor for anybody.
And, it's like the energy drinks too. The energy drinks are packaged to, be strong, get all this energy.
Yes.
Are there any laws what could we do to prevent? I don't care if people smoke. I thought the reason why the smoking numbers went down is because people were dying off. When I many years ago thought I was going to be like the Camel and Joe
Right.
Cool, and I smoked a cigarette. My mother found out about it, and she took a whole pack of Camel unfiltered cigarettes, bought them for like $1.88, and made me smoke the whole damn thing in front of her. I got sick, and I would never
So
touch
I was
a
going to
cigarette
ask how'd you
again.
quit because it's very tough.
How do I
I'm a
quit?
former smoker.
I threw up is how I
Yeah.
quit. I'm like,
Yeah.
just like I don't drink Jack Daniels anymore because I threw up on that because I don't want to do it.
Well, most vapes are illegal, like non-FDA approved vapes and which are many that you see in local shops are illegal. And all tobacco, nicotine related products are illegal to sell to minors.
Under 21, all
Under
right?
21,
Right.
yes, thank you.
So
Well,
how are the
that's
kids
it.
getting this stuff if it's illegal?
A lot of the students have stated that they get it through older siblings, and some of the parents just haven't been educated that some of these products are not candy products, that they are nicotine containing products.
So we do have some education, and it doesn't always. There's like stuff it's not the majority of parents are
Right.
purchasing this. So we're not saying that, but there are some instances where there needs to be more education around vapes and vaping and the dangers.
And I want to chime in there too. A lot of those kids did state that their parents thought that they were buying the nicotine-free vapes
That's a
that
good
were
point. Yeah.
just flavored candies.
Why would they do that? Just drink. It's like the same thing as drinking decaf. It's
Well, they may be trying to help their child if they already know they're smoking, for
Right,
example.
yeah.
Exactly. And
Sometimes.
that is
Or
also
choosing tobacco.
Yes.
Is that what you're
yes,
hearing in the school?
absolutely. That is what I'm hearing from the students themselves, who are being very transparent.
And you mentioned, no, Julie mentioned prevention, like in her prevention. So that goes back to what we talk about a lot, Jeff, is that in public health, we do promotion, prevention, protection. So we don't treat folks.
Right.
In other words, if you come into the health department and you want to prevent flu or the spread of flu in your community,
Right.
flu shot.
Sure.
If you walk in with a 103-degree temperature, body aches, we're going to send you to urgent
Mercury.
care or ER to your doctor. So we don't treat folks as a general rule. We're preventing, bad
Initiation.
things, bad outcomes from happening. So what Julie does is tries to prevent more youth from getting on tobacco, and then just protect individuals in the community if they've already started smoking through several programs. So she's either providing prevention education or cessation,
Sure.
where she's trying to help them quit
Sure.
using nicotine products.
So I think it's really hard to grasp the youth these days and what they're doing. Their hormones are going crazy, and you would think that if there's a handsome boy or a good-looking girl and they're sitting there smoking, it's like kissing an ashtray. Why would you want to have that on your breath? It's not cool looking.
That's the challenge with vapes.
Yes.
Is there's no smell.
There's no smell. And if there is any kind of odor or smell, it's usually a fruity, pleasant smell.
But aren't there like aluminum stuff that goes into your lungs and through the vaping and isn't that hard?
There's a lot of dangers with vaping, and then the ultimate real challenge or issue is that it gets them addicted to nicotine.
Right.
So I think vapes were introduced originally as supposedly as a smoking cessation.
Right.
Yeah, for adults.
It's like Suboxone for the drug guy.
Exactly. Every single one, and it gets abused.
Right,
It
yeah.
certainly vapes. The concept around
Sure.
a vape as a cessation tool has been abused.
And I guess one of the other things is you've got kids who are playing sports and their coaches take a big wad of chew and they put it in their thing and they're spitting and gooping all over the place, and all that must be cool and it helps them. I had football coaches and baseball coach. My wrestling coach was even a big chewer, and I'm like, I tried that one time. I threw. What is wrong with people? All right, so we're an adult, and I'm through my high school years. I'm into my college years. I've been smoking for 10, 12 years. And I just decided that, I got to quit. It's bad for me. I can't walk 2 blocks without wheezing. I come to the Pike County Health Department. What do you do?
Okay. Once you come into the health department, I introduce myself and I tell you the programs that we have at the health department for cessation. We use the American Lung Association's Freedom from Smoking curriculum. It is a 40-year evidence-based curriculum, and it's been deemed the gold standard, meaning it is the best cessation curriculum for adults. And I talk to you about the curriculum. I tell you how the curriculum is set up, how it works. So it's an 8-week curriculum. I can offer that in person or I can offer it virtually. We work through class modules using a participant workbook each week, and we will meet once a week for approximately about an hour, at maximum an hour and a half, usually on the first few sessions. We talk about triggers and cravings, and we really dig in to find the root of what is causing you to smoke and what is causing you to kind of cling to that nicotine addiction. And we train our brain and we talk through methods that are going to help deal with some of those cravings and some of those triggers and how to power through them.
Are the visuals of people who lost half of their cheek or have that little thing in here in their throat, are they powerful enough to let people like look and say, you don't want to wind up like this person who lost their lung and now they're on the iron, they're breathing through the tube in their throat, or if they lost half their face because of that? Is that an effective?
It is an effective resource to use in cessation classes, and we actually have a whole component that is geared toward former smokers and former smokers who have had amputations and tracheotomies and cancers and things like that.
When you have models too, right?
Yes.
Lungs,
Yes.
dirty, like
I have
not dirty, sick lungs.
Right.
Yes.
Yeah.
Versus a healthy, clean
Sure.
lung.
Right. Yeah. And it's got to be, when you see a smoker, they got the hands are all dirty from smoking the cigarettes. They got their eyes, their clarity. And so let's talk about what happens after you say, I'm going to stop smoking. What happens to your body?
Okay, within 24 hours, your carbon monoxide level in your body begins to go back to a normal level. Within 40 to 78 hours, you're going to start to feel better as far as shortness of breath and wheezing. You're going to have a regular heartbeat again, and the healing process or the withdrawal process and the body cleansing process starts. So then it's gross, but you're going to start having the flame and the things like that your body is going to heal and rid itself from.
The thing about COPD, though, if you have chronic COPD, once you get that diagnosis, you can't reverse
It's not reversible.
But you can keep it from There's hope.
Yes.
You can keep it from progressing. There's good medicine out there if you quit smoking. There's good medicine out there, and you can prevent progression.
Absolutely.
So there's a lot of hope. I mean, we know that heart disease and cancer remain the top 2 causes for death in the U.S.
Sure.
And I think you'd have to almost be living under a rock to not know that tobacco and smoking, are huge risk factors for heart disease and cancer.
And when we talk about abstaining or cessation of this, we're not talking the patch, because the patch delivers tobacco to your system anyway, right?
Yeah, we do provide those tools.
But I mean, does the tobacco get through the body through the patch, and doesn't that affect your heart rate and all that stuff?
The nicotine,
right?
It is proven that nicotine replacement therapy through either the patch, the lozenges, or the gum is effective with the Freedom from Smoking treatment program and the counseling program. It's very highly recommended to do both at the same time. And it is very effective in my experience as being a Freedom from Smoking facilitator. After you reach week 4 of that Freedom from Smoking 8-week course, you're going to be tobacco free as far as a tobacco product that you're willingly use.
It's a rapid titration.
Sure.
We go from 21 milligram to 14 milligram to 7 milligram with the nicotine replacement therapy. And then by graduation day at week 8, the individual should be completely off nicotine products and nicotine replacement therapy as far as a treatment.
Sure.
I quit years ago using a very similar model. It was called Cooper Clayton. Thank you. This was years ago. It works. It works. It really works. And
how long were you a smoker for?
Well, I smoked off and on. I didn't start till I was an adult. So, we won't go we won't go down that rabbit hole. But I was an adult, young adult, and I started smoking. And I smoked off and on. I would take a 1 year break, one time a 5 year break, but then ultimately stressors, I would go back.
Sure.
And I had a friend join me, and what was it called again? Cooper Clayton. And the hospital was offering the program, and I tried everything: acupuncture, hypnosis,
Everything.
the patches. But there was something about the combination and freedom from smoking, which is ALA approved, very similar group dynamic approach. There's just something about the combination of being with others that are going through the same, on the same journey.
Sure.
And using the products. They were free, so that was an incentive, and for me at the time. And you had others around you, some support, and there was accountability.
Yeah, talk about the support and the accountability, because what happens is that when we try to release ourselves from an addiction,
It's a powerful,
it's hard, and if nobody's looking, what do we do? So how does the support and the accountability work?
The support in my groups is phenomenal. Everybody rallies around one another. They're eager to jump in and tell things that work for them or alternative ways to deal with cravings. They exchange phone numbers or maybe a Facebook account or something of that sort where they can have that added support and mentorship outside of the classroom. And they always are willing to call me if they slip. If they slip, I always tell them, call me. We'll kick that bicycle and we'll get right back on it. We'll get you where you need to be. Just need to be transparent and honest. And you learn something new about that slip.
Sure.
There's something that blindsided you, and we can get you through it.
What do you recommend these people who are trying to get free from smoking and abstained or get clean from smoking? Do you recommend them to go get lung scans or anything?
Absolutely. We were talking about that.
Huge
over
advocate.
here today. The low dose CT scan is
Pikeville Medical Centers now, they've got a huge advertising campaign about low dose CT.
I made my husband go do.
Well, I mean,
but at a certain age, you get what they call a 20-pack year,
20-pack
year smoker.
Mhm.
And Julie was explaining to me, I thought that meant 1 pack a day for 20 years, but it could be 2 packs a day for 10 years.
Yes.
Or if you haven't quit smoking for a period of 15 years or longer, that's the recommendation to get the low dose CT scan. Like many other cancers, the earlier that you can catch that, the greater outcome for you as an individual.
It's like anything else. We talked last week about the breast cancer thing. Your body's going to tell you what's wrong with it. You guys don't ignore it. So, Julie, talk to me about like the hardest part of your job, and then talk to me about what is the most rewarding part about your job. So what's the hardest part? What makes you not want to get out of bed and go to work every day?
No, I always want to.
Not me.
Besides having to work with this stuff over here.
It's not my director. I love what I do. I'm very passionate about what I do. So I don't really have many days where I don't want to get out of work or get out of bed and come to work, should I say. I'm really passionate about it, and I get fired up. I tell the kids in the classroom, I was like, now I'm going to start singing, and you're going to have to hush me up because
I cessation for kids.
I do cessation for kids as well. And the youngest I've had is a 4th grader, which just blew my mind because I'm a mother myself. But it's hard to
generational.
It partially is generational. Yes, and
we see Meemaw and Peepaw, and then their mom and dad and their uncles and brothers and cousins. So they decide it's there, and
we're role models for our kids,
right.
And older siblings are role models.
If I were in your shoes, you know how I would answer that, and because I've heard you say. It's when you get real excited and someone signs up for smoking cessation and they need it, and they've got early stages COPD or maybe even late stages COPD, and then they don't show.
Yes.
Or they have barriers to showing, and we try to work around that.
Around the barriers.
You get really discouraged.
Sure. I do. I've had 15 people sign up for a class before, Jeff, and then I went in and I didn't have anybody show up, and I'm like, what in the world? What happened? Where's all my people that were so excited to quit smoking? And then they were all out smoking, and I was like, and I've learned to not internalize that for me because I'm there to do a job. I'm available whenever they need me. But
Big wins. Too.
I do have big wins because I've had gentlemen that have needed surgery. They had to be tobacco free to have these life-saving surgeries, and they were able to have them.
Well,
And they've remained nicotine free. I've had people that see me in Walmart and they're like, it's been 5 years, but
that's got to be greatly rewarding. So that's just another way the Pike County Health Department is helping people stay healthy and save lives. So talk to me about, so how do people sign up for the classes? What do they do? Do we go to your website? Do we pick up the phone and call? Do we call you at 2:00 in the morning on your private cell phone? How do we get?
It is on the website.
It is on the website.
What, your private cell phone?
No.
Oh.
Julie's
Sorry.
contact. I'm surprised if mine's not, because everyone knows it. But Julie's email and your office phone number's on there. But
Yes.
if she has a cohort like starting, we post that on social media as well, and we put it on the website, and we put it in the paper as well.
Yes.
www.pikecountyhealthdepartment.com, right?
PikeCountyHealth.com.
Or PikeCountyHealth.com, or the phone number to call.
606-509-5500 and ask for Julie.
Ask for Julie. So smokers, if you're smoking and you want to quit because you want to be around for your kids, your grandchildren, or you just want to live a healthier life where you can breathe. Right now it's 74 degrees. There's not a cloud in the sky. It's a beautiful, beautiful day to be alive. It's a beautiful day to be alive.
Yeah.
We want Pike County to stay healthy and be healthy, and quitting smoking, quitting tobacco. Don't start on the tobacco.
Right.
It's a great way to do that. Pick up the phone, call Julie, go to the website, go to the classes. And if you're lucky, and you're at one of these classes and you're stopping smoking, you'll see Tammy running around like a crazy person there. So, ladies, thank you very much for coming by. Thank you for doing what you're doing. Thank you for keeping us smoke-free, getting us out of the problems. I can't thank you enough for what you do for the community and what you do for our county. Ladies and gentlemen, join us. Thanks for joining us. We really appreciate your time. Ladies, have a great day.
Thank you.